procedure, we will need our PE forms and papers which we can write our notes on, a pen, and the gloves for the PPE. We're now here at our client's crib, so we're going to verify the client's name first on the crib tag and on the baby's hospital tag. Usually it is on the wrist or on the ankle, so let us check. So Alex Cruz, born on April 19th of 2020 and male. So we have the right patient. So I'm gonna put on my gloves. This will protect the baby and us from any cross-contamination. And remember, we're handling newborns, they're very fragile. So we have now removed the blanket or the wrapping of the baby in order for us to assess him much more thoroughly and effectively. So we're going to start by assessing the client's vital signs. Let's start with the respiratory rate. So the normal is usually 30 to 60 breaths per minute. So we're going to assess for any respiratory distress. We can see that if the baby is having nasal flaring, so there is no presence of that. And there is no chest retractions. We're gonna assess the breathing. We're gonna count it for a whole minute, unlike in adults, which we can do it for 30 seconds and multiply it by 2. In babies, we have to actually watch the rise and fall in order for us to get it properly, because their breathing varies from the adult. So we're gonna look at the rise and fall of the baby's chest, and we're gonna count it for 1 minute. So baby's breath is 38 respirations per minute. So now we're going to assess the baby's heart rate. So the normal is 110 to 160 beats per minute. So when a baby cries, it actually varies. We're gonna use a stethoscope, and specifically the bell. So assuming that this is for the infant, so the infant size is usually smaller. We're going to use the apical pulse in order to count the heart rate of the baby. So we're going to locate first the fourth intercostal space from the baby's clavicle. We're gonna go down 1, 2, 3, and 4, and we're gonna go lateral and just below the nipple. And we're gonna start listening for a whole minute. So the baby's heart rate is 142. Now we are going to check the baby's temperature using our digital thermometer. The usual is 36.4 to 37.4 degrees Celsius. We're going to take the auxiliary. So we're just going to turn on the thermometer, and we're going to place it in the auxiliary, and make sure to put the arm down while doing so. So the baby's temperature is 36.8. Now we're going to weigh the baby, assuming that this is a baby scale. We've also removed the infant's clothing. Make sure that the diaper isn't soiled, and we're gonna weigh the baby. So the baby weighs 8 pounds. So we're now going to take the length of the baby. We have laid him in a flat surface that's lined, and this is clean. We're going to mark the ends of the baby from the toes to the baby's head. So we're gonna need a pen and the tape measure. So we're gonna hold the baby's head down midline, and we're gonna mark that. And then we're also going to hold the 1 foot of the baby down, and we're also going to mark that. So after marking the ends, we're going to use our measuring tape to measure the length of the baby. The usual length is 18 to 22 inches, and our baby is approximately 19 inches. So now we're going to assess the baby's head and head circumference. The normal is 33 to 38 centimeters. We're gonna start by lifting the head slightly, just for us to put down our tape measure, and we're going to measure it. So our baby's head circumference is 35 cm. Now we're going to assess the baby's chest and get the chest circumference. So we're gonna put the tape measure beneath the baby, and we're gonna use the nipple of the baby as a guide. And there we go. So the usual chest circumference is 1 to 2 cm less than the baby's head. So the baby's head is 35, and this baby's chest circumference is actually 33 centimeters. The baby's chest does not have any obvious deformities. Now we are going to assess the baby using the Apgar scoring. We're gonna start with the heart rate. So we assessed it earlier. It was 142. It's greater than 100, so it's 2. And the respiratory effort, it is good and strong. That's also a 2. The muscle tone of the baby is active, so he was moving around just now. The reflex irritability or the grimace is crying and vigorous earlier. The color of the baby is pink in the body and a bit bluish on the extremities. So there's presence of acrocyanosis, which is perfectly normal for a newborn like Alex. So overall, the score of the baby is a 9, which is within the normal range. So the baby's gestational age is 38 weeks. He is a term baby, and the weight is also assessed earlier. He is 8 pounds, approximately 3,600 grams. Now we're going to assess the baby's skin. First, let's start with the color. So it's normal, and also the tone. We're going to also check the body for any birthmarks. So there's one here, and that's normal. Also, the vernix caseosa is present. Of course, it's a newborn. It's not supposed to be removed. The lanugo is also present, so there's moderate amount. There's also desquamation or the flakes and peeling. It's also normal with a newborn. There's also presence of milia, especially on the nose, the white spots. We also have erythema toxicum. It's present, but it will go away eventually. It will disappear. There is no forceps mark, no lesion, and the baby's skin turgor is good. Now we're going to assess our baby's head. So let's start with the fontanelles. It's still open. Suture lines are appreciated, so the suture lines and the fontanelles will disappear with time. There is also presence of molding. This is also normal. No presence of swelling and no cephalohematoma. Now for the baby's eyes, we're gonna examine the external and internal structures. So all structures seem to be present. No problem and no abnormalities. We can see the pupil, the sclera. There's no signs and symptoms of infection or any bleeding. The baby's ears seem to be in good skin condition. It's normal. There's no skin tags on the infant. For the baby's nose, there is the presence of milia, the white spots. We're going to check for choanal atresia or any blockage in the nostrils. So we're going to occlude one nostril and let the baby breathe through the other. And the other side. Okay, so baby was able to breathe through both nostrils. There's no signs and symptoms of distress. Now we're going to assess the baby's mouth. We're gonna start by looking if one side curves when the baby cries or opens his mouth. It suggests that the baby has facial nerve injury if one side curves. The mouth should open symmetrically, so that's what happens to the baby. It's symmetrical. We're also going to inspect the tongue. If it's short, normal, or tongue-tied. So our baby is normal. We're also going to inspect the palate. So it is intact. There is Epstein pearls, which is perfectly normal and will disappear with time. Now we're going to assess the infant's neck. So it is normal and creased. It is also short, usual in newborns. So the head rotates freely. So if it is rigid, it indicates that there is injury to the sternocleidomastoid muscle during delivery. So the head control is also present. So upon earlier inspection, the chest is actually 33 centimeters. It is 1 to 2 cm less than the baby's head.
The infant does not have a supernumerary nipple or a third nipple. It is usually found in line with the nipple.
So it is symmetrical. The clavicles are smooth and straight. We've also assessed the respiration. It was 38. The normal is 30 to 60 and no presence of retraction. Now for the baby's abdomen. So it appears normal and not sunken or scaphoid. It appears protuberant. We're also going to auscultate for bowel sounds. It should be present within an hour after delivery. So we're gonna start. We're gonna do the same way as we do in adults, but for a whole minute. So we're going to do it counterclockwise, starting at the upper right quadrant. So the bowel sound is appreciated, no abnormal bowel sounds heard. So we're also going to palpate the baby's liver on the baby's right side. So now I am on the left side and we're just gonna palpate it. So it's usually 1 to 2 cm below the costal margin. We're also going to palpate for the baby's spleen. It's also 1 to 2 cm below the costal margin. Okay. Now we're going to inspect for the baby's umbilical cord. Remember the AVA, the baby should have 2 arteries and 1 vein. So it's present. We're also going to assess for any bleeding of the cord at the base. So there is none. It should not be wet because if it is moist and with odor, it indicates infection. We're also going to check the diaper if the baby has voided. So the baby has actually voided. The kidney function is normal. We're now going to palpate for the baby's kidneys. We're gonna do deep palpation on the right side first. So it should not be too small and not too big. And the other side. Okay. So if the baby's kidney is too small, it may indicate poor functioning of the kidney. And if it's too big, it might be pooling of the urine due to urethral obstruction. Now we're going to elicit abdominal reflex. So we're going to do that by stroking each quadrant with our finger. So the umbilicus should move towards the direction of our finger and where we stroked it. So it actually moved towards the direction of our finger. So this is the superficial abdominal reflex. It indicates the spinal nerves T8 and T10. So now we're going to assess the client's genitalia. We're going to assume first that he is a male. So we're going to put down the diaper. Now we're going to assess if the meconium has passed through. So it has. The penis should be approximately 2 cm. The urethral opening is at the tip of the glans. It's normal. So we're going to slide the foreskin to inspect. So the scrotum is a bit edematous, so it's normal because he is a newborn. We're going to palpate the inguinal ring. Okay, and then the baby's testis. So So we're going to now elicit cremasteric reflex by stroking the internal side of the thigh. So as I stroke the inner thigh, the baby's testis should move upward. So the testis moved upward as I stroked. So now we're going to assume that our baby is a female. So for a female, we're going to inspect the vulva. So the vulva is normal. There is presence of swelling, but that's perfectly normal. We're going to assess also for vaginal secretions. Pseudomenstruation is normal. It is blood tinged. So it is due to the maternal hormone and disappears usually 1 to 2 days after birth. Now we're going to inspect or assess the baby's back. I'm just going to turn him to the side, making sure that I am assisting him. So the baby's spine appears to be flat in the lumbar and sacral area. So there is no pinpoint opening, no dimpling, and no sinus tract. So a sinus tract could be an indication of dermal sinus or spina bifida. Now for the baby's extremities, we're going to inspect the arms and the legs of the baby. So it is usually short and proportional to the trunk of the baby. So the hands are plumped and clenched. So that's normal. The fingernails are soft and smooth. It's also extended over the fingertips on both hands. Now we're going to unflex the arm to test the muscle tone of the baby. We're gonna unflex it for 5 seconds. So as I hold it down and release it, the baby should flex it back because it's their normal reflex. So the baby flexed back his arms. So we're gonna hold the baby's arm again downward, and we're going to assess the length of the arm. So the fingertips of the baby should at least go as far as the middle of the thigh or the mid-thigh. So this goes as far as the mid-thigh, so it's normal. Short arms is an indication of achondroplasia dwarfism. Now we're going to observe the curvature of the baby's finger on both sides. So it is normal. So it's normal. So we're also going to assess if there is presence of simian crease or the single palmar crease. So there is none. Single palmar crease is an indication that the baby may have Down syndrome. So now we're going to assess the baby's fingers for webbing. So it's not stuck together, so there's no webbing. There's also no presence of syndactyly or polydactyly or extra fingers. The fingers are not fused together, so that's perfect and normal. We're also going to assess the movement of the arms, the left and the right, and the legs for symmetry. If it's asymmetrical, there might be an injury to the baby's clavicle or brachial or cervical plexus, or even fracture to the long bones. So it is symmetrical, the arms and the legs. So the legs are also short and bowed. So that's normal for a baby. The sole is flat. This is due to the extra padding of fat. There's also the presence of crisscross lines on the soles of the feet. So we're also going to move the baby's ankle to see the range of motion. So the baby's heel cord is not unusually tight. Now we're going to assess the baby's ankle clonus. So the normal result is that the baby should try and plantar flex his foot, because I'm going to dorsiflex it for a few seconds. It should be rapid alternating contraction as I push it up. So there is contraction. The baby's trying to go against the force. Also on the other side. So the abnormal finding is if the baby relaxes or does not have any contraction with the dorsiflexion of the foot, it may be an indication of neurologic or calcium deficit. So our baby was actually contracting as we pushed the ankle up. So there is varus deviation. It's perfectly normal, and the feet is turned in. Now we're going to test or inspect the femur of the baby to see if the hip is situated in the hip socket. So we're gonna first flex both hips and then we're gonna abduct it. So we're gonna look if the legs are abducting at the same time. So they both are. There's no popping sound heard, so it's a negative Barlow and Ortolani test. There's also no missing toes or extra toes, so the spacing is also normal. After the assessment and inspection of the baby, we have wrapped him back again and we've placed him back in the right crib. So after the procedure is done, we're going to validate the data for accuracy and completeness. So every finding during the procedure came out as normal. There were no abnormalities, and mostly the findings were aligned with the age of the baby and the state of the baby. We will now discard our PPE and throw it in the proper bin, and we're going to do hand washing. So after the procedure, we're now going to interpret the results to identify if there's any abnormalities or any results that came out as not normal. So mostly all the findings were of normal levels and were correlated to the baby's age, weight, length, so everything was aligned and normal. We do not need to report any significant findings because all findings were normal in a newborn. Now we're going to document all the data and the findings during the assessment.